43 years of independence, we still don't have basic healthcare facilities. A man has to be transported in a wheelbarrow 20, 30 kilometers for a hospital. Joseph Lekuti. The COVID-19 pandemic showed us all over the world the critical importance of having an effective healthcare system. Across Africa, we're 15% of global population, yet we're responsible for a disproportionate 26% of global disease burden. This is further exacerbated by the reality that we only have 3% of global healthcare workers, and we only represent 1% of global healthcare expenditure. Yet that 1% still stands for $150 billion in healthcare spend in Africa in 2020 alone. The healthcare African market is characterized by massive fragmentation. We have an insufficient number of facilities to cater to existing demand. We have a problem with access to healthcare, where many people, millions of Africans across the continent, still do not have access to healthcare. And even for the ones that have access to healthcare, for the existing providers, the existing healthcare facilities, you have fragmentation which leads to high costs. You have a lack of investment in technology, not just technology in the operations to improve efficiency, but also technology in the actual delivery, which creates a suboptimal situation where we're not able to make data-driven clinical decisions. You also have a massive problem with human capital deficiencies. We know we do not have enough doctors per capita across the continent, but we're also not investing in necessary technologies like telemedicine or artificial intelligence to allow us to benefit and leverage from the existing human capital base that we do. This is further compounded by the reality that when you put it all together with the fragmentation, with a lack of investments in technology and adequate data systems and infrastructure, with an insufficient number of facilities, and you layer on the human capital deficiencies, overall it leads to a situation where we have low access and low quality care. This is a major problem with implications for our economy, with implications for lives, and with implications for the future of Africa that we so badly want to see. By 2022, $25 to $30 billion will be needed in physical healthcare assets alone. AHH seeks to fill the widening gap by investing capital to build a network of healthcare facilities across Africa. We see unique opportunities to consolidate a fragmented healthcare market and to develop a network of high-quality, technology-enabled healthcare facilities under common management, which will lower the cost of care delivery through network effects and economies of scale and scope. Established in 2017, the Africa Health Holdings Company has begun the building of a patient-centered, technology-enabled, effective, and sustainable quality healthcare network across Africa. We are building Africa's healthcare future. AHH, through its network of healthcare facilities, is making great contributions towards expanding access to healthcare and making healthcare more affordable. AHH has raised $13 million to date in equity financing as part of our seed and Series A rounds to expand our network and invest in technological innovations like telemedicine, which will lower the cost of care delivery and improve health outcomes. Our expansion strategy is focused on adding hospitals, clinics, pharmacies and labs to our ever-growing network. Our network currently includes Rabito Clinic, the market's leader in dermatology and general medicine in Ghana with 19 branches, and CarePoint, a vibrant new brand which presently owns 2 hospitals in Lagos, Nigeria. We are in the final stages of acquiring a large chain of 19 healthcare facilities in Kenya. This will transform us into one of the largest healthcare providers on the continent. Our goal is to continue to expand and consolidate the market with a clear business plan to grow to 300 facilities in our key markets of Ghana, Nigeria, and Kenya. Our transformation of Rabito Tema is illustrative of the impact we have on facilities in our network.
We've been able to move from an almost strictly pencil and paper environment to having almost all of our branches completely computerized. We were operating in the wilderness. We had an idea of what was happening on the operational side of our business, but we didn't know for sure. And when we were able to invest in technology that tracks what we're spending on, we'll pick a very simple example, what we might be spending on cleaning supplies. When we were able to track that, we recognized that if we centralized our purchasing power out of head office, it gave us larger economies of scale, which in turn helped us reduce our overall costs. So that was one way. The second way we recognized that operational efficiencies could be improved was by taking a microscopic look at our entire workflow and using that workflow to determine how can technology help us decrease the times the patient has to wait to get processed. We are the first accredited facility in Ghana that is offering telemedicine to those in Ghana and beyond. MyCare Mobile is transformational and innovative because for the first time, patients are allowed to see a doctor from the comfort of their home or office. And what's more, if they feel that they just want to get a lab test done or purchase medications that is not prescribed, they can call MyCare Mobile and it can be delivered directly to their door. Hence our motto, comfort, convenience, and confidentiality. Our marketing and business development team have been so fundamental on is using social media to answer health questions. Now we have patients coming to us and saying, I saw on your Instagram page that this condition that I thought was just natural, it's something that can be treated. I'm here for treatment. Technology is going to be the driving force with the help of Africa Health Holdings to make Rabito the dominant healthcare facility on this continent.
From the entrance till you see a doctor, it's paperless. At a click of the button, you are good to go.
The previous day that I came here, and I think I didn't come with my card, and I was thinking maybe they will ask me to go home and bring it, but within 2 to 3 minutes, they just asked one question that they can use it to retrieve all the necessary information, and within that period, I was able to get my folder and to see the doctor.
My first experience was at Dansuman branch, which a friend introduced me due to an acne problem, of which I had a great experience based on the customer relations and the doctor's advice.
I had a bad nail because a car banged my nail and the nail was going bad and everything, so I had to come show to them and see if there's a way we could find a solution, because I had a lot of insecurities walking around with a very bad nail.
I had a great experience based on the customer relations and the doctor's advice. It did improve. I saw changes, and later on I had my cure as at that point.
I recommend Rabito Clinic to my family or friend or anyone who has a problem with a skin or with a nail, that yes, they can troop in and have them run a test or anything on their skin and find out what exactly is the root cause of the problem, and then they'll sort it out.
I'm a public health physician and consultant obstetrician and gynecologist with special interest in fertility and reproductive endocrinology. For all of us, it has been a patient-centered care, centered around taking care of our patients and making sure the brand, which is the hospital, the CarePoint Hospital brand, has this international and puts national touch. I've also started up with our fertility clinics, which we are also upgrading to become into the level of assisted reproduction.
We designed a manpower planning for the next 5 years, which is a human resource model that sort of guides us on our recruitment plan. We make sure that our recruitment process is so tight that the candidate that is eventually picked for the role is a candidate that is able to do the job and also fits into the culture of the organization. We also have a performance-based system that is tied to our reward structure, ensuring that all our employees are not only trained to deliver the best quality of service to internal and external stakeholders, but they are also rewarded for their productivity.
We pride ourselves as providing high quality care and patient-centered care. Also for patient satisfaction, which is one of the outcomes that we measure, our standard is 90% patient satisfaction. One of the things that has helped us so far is to reduce wait time. We've worked in each of the clinics and hospitals to ensure that wait time is reduced to the minimal. The structure of our buildings in our hospitals have also been very helpful in this. We've designed it in such a way that the patients move from one unit to another. We are currently using the Safe Care standard to improve quality in our facility. In each of our facilities, we have quality champions that make sure that the improvement processes that we have put in place are followed through.
I've been using Chevy for the past 3 years. I gave birth to my boy at the year 2017. I gave birth to Bina 2020. I've been enjoying CarePoint Hospital services. Their doctors are doing great. The nurses are responding well to the patients. They're trying their best. CarePoint Hospital, they are on point.
CarePoint Hospital also goes as far as offering surgeries, and we have specialist consultants in varying areas who visit us. We have ENT consultants, we have orthopedic surgeons, we have general surgeons who come and offer their services for us here at CarePoint Hospital. So CarePoint provides prompt, adequate and sufficient care, and this has been the story for the 2 years that I've been with CarePoint Hospital.